Hi, welcome to VCC TV. Today we have with us Chairman and Director of Healthcare at Home, Mr. Gareth Jones. Thanks for coming on the show, sir.
Pleasure, pleasure.
Starting off, tell us more about the Healthcare at Home model. How is it different from a community care?
Okay. Well, first of all, there are a lot of misconceptions about home care. The whole concept is about managing and caring for people outside of hospitals as much as possible. And I think the way medicine and healthcare has evolved over the last few decades with the help of technology and connectivity means that there are a lot of things you can do and look after patients, care for patients in the community that just simply don't need to be done in hospital anymore. Hospitals were Victorian institutions invented to really isolate people with infectious diseases from the general community. Then they morphed into specialist centres. The whole model for medicine was an institutional or doctor-centric model where patients have to go to them to be cared or treated. Now the whole shift is away from hospitals and care in the community. You can only do that with the right resources, with the right training, with the right staff, and with the right clinical governance, if you like. It's not an alternative, it is a complement to the existing model. And hospitals, I've been running home care services in the UK and other countries for nearly 20 years now. What I do know is that hospitals are expensive places and they are at times dangerous places because people get hospital-acquired infections. Home care, if you have the right levels of expertise and clinical excellence, your infection rate in the community is a tiny proportion of what hospitals have, and I know it's more cost-effective as well.
Okay, if I may ask, you're already an established brand over UK and Europe.
Yes.
Why come to India?
Why come to India? Well, first of all, India is very close to my heart. I came here to CMC Vellore as a medical student I hate to say it, 1976. But India has a great opportunity at the moment to leapfrog a lot of the lessons of the West. Just take telephony for an instance. You don't have landlines because everyone's gone mobile. You have the opportunity now. You don't have to build a hospital every day for the next 10 years just to meet demand. Home care, with the right resources and people and technology, can fill that gap and do a lot of that. And India is the need is there. Everyone I speak to when I come to India, and I've been coming over the last 4 years, everybody says this is the need of the hour. And it's the need of the hour because you've got 300 million middle-class people spending a lot of money on healthcare. Their only avenue at the moment is to go to a specialist hospital, spend a lot of money. If they're an inpatient, they're spending even more money. Then, let's say, post-operatively, they're scared of leaving hospital because there's no one to look after them at home.
Yeah.
Home care starts to fill those gaps. And we talk to many hospitals and say, look, you offer an excellent package of care in the hospital. Why don't you team up with us and we'll continue that care in the community. Patient will be very happy because it's all about meeting the needs of the patients. We spend a lot of time not just caring for patients but educating them and counselling them, encouraging them to look after themselves better. And that will keep them connected with the hospital as well. So it's a very it's a logical route to a more modern healthcare system.
Well, what are the operational bottlenecks that you're facing in India? In the sense, UK must have been a very different domain, and now coming to India, it's completely different.
Yes.
And second, there's this law of large number that plays out.
Yes.
A billion people you have to cater to, most of the population out there. So what are the operational bottlenecks?
Okay, I mean, there are some fundamentals that are exactly the same, the need is there, but I think there are a couple of, 2 or 3 that I can think of. One is the mindset of the patient is, I have to go and see a doctor at a hospital because they have no alternatives. Convincing a patient and a doctor, to be honest, that there is a perfectly good, in fact better system that could be employed by looking after them at home, we have to build that trust and confidence in the doctor and the patient. Once they avail themselves of a home care service, 70% of all our patients are repeat patients. So, and what we must do is collect the evidence that whatever we do at home is safe and the clinical outcomes are excellent and it's cost effective. Once we've done that, then it starts to reinforce and reinforce. But I think the other major challenge is recruiting and then training the healthcare professionals. So everyone knows there's a huge skills gap and shortage in India. So not enough doctors and not enough nurses. So the nurses and physios and people we take on board, first of all, we select them carefully and then we put them through quite a long and rigorous training program. Not just on the clinical skills, but also behavioural skills. It's a privilege to look after someone in their own home, so you have to behave properly. You have to cover all the safety and contingency plans. You know, what happens if you're giving a drug and there's an anaphylactic reaction? We have all the safety equipment with us, we have all the protocols that says this is what you do, and they're all trained. So our nurses are all BLS trained, they have oxygen equipment, they have anaphylaxis kits, they know what to do if something untoward happens. And you know, occasionally it does. And the worst thing is, if they're really worried about a patient and they've talked to the doctor, let's get them into a hospital. So we have tie-ups with ambulances and the like.
Okay.
So I think that's the biggest challenge.
Let's talk about numbers now.
Yeah.
What is the workforce that you have in India?
Okay. So yes, and
how many people are you catering to at this moment?
okay. So at the moment, Healthcare at Home has about 500 people, staff. 80% of those, at least 80%, are frontline care providers.
Okay.
We have different healthcare professionals. We have specialist nurses, so we have even oncology nurses who will do home oncology. We have orthopedic nurses for post-operative care and things like that. We have general nurses. We do have healthcare assistants. All these people are trained, so there is a demand out there for 24/7 sort of low-tech care that is always connected with nursing care as well for the patient. We have physiotherapists, we have counsellors, nutritionists, you know, and a tail like that.
Yeah.
So 80%, at least 80% of frontline staff. We're now catering to, well, on our books we have had about 30,000 patients.
Okay.
At any one time, it depends on, you know, we're in Delhi, Chandigarh, Jaipur, Mumbai, Bangalore, Hyderabad, and a small presence in a few other places. So we're growing quite rapidly. What we've done is set a clinical framework and a foundation for the business on which now we're going to build different services. So we're working with the pharmaceutical industry to provide services around some of their patients. We're working with the private insurance industry to, because we can now prove that some home care interventions are more cost effective than in hospital. And we're also looking at disease management programs like diabetes, because there's a huge unmet need in diabetes. So I think we're at an inflection point where numbers and scaling up is going to be very significant over the next couple of years.
One of the things that's different in India is the insurance part. Insurance doesn't cover home care. Right.
Well, yes, that is changing.
And that is changing now. How have you seen the sector evolving at that junction?
My impression of the, you know, everyone tells me that health insurance here is quite small, it's not making any money, it only covers inpatient care. That is starting to change quite quickly, and we're now working with, I think, 3 insurance companies. So it will take time. It'll take time to, for the private insurance market. I think they're not terribly agile. They need to think through some of these things, and I can guarantee in 5 years' time, the insurance market will be covering home care pretty widely.
Let's talk about the investment side of the model.
Yeah.
Right. You've secured a JV from Burman.
With the Burmans, yes. Yeah.
When you entered India.
Yes, yes.
What are the investments that you're looking at?
Right.
And is there another round of funding that is coming?
Yeah. Okay. So it's a 65-35 JV. The Burmans having the majority of the business, and they have put the majority of the the funding into the business. Charles and myself have put the balance in. We're just now at the stage of looking for new capital to come in really for this next growth phase. And we're probably, for the next couple of years, need something in the order of 100 crore. After that, probably over the next 5-year period, we probably need sort of in the order of 300 crore total. So not huge amounts of money. And we've started to meet, PE and VC companies. Lots of interest and sort of excitement around, but I think we're in a slight cleft stick where we're not quite startup and we're not quite established, so we're in the middle bit, and that causes a few people to, we don't quite cross their criteria for this, or we're too small for some of the big Ps and we're too large for the VCs, too far advanced. All I say to them is Apax, one of the biggest Western PE firms, invested £1 million in healthcare at home in the UK in '95, and in 2007 went away with 100 million. So they made 100 times there. I know, if we find the right investors, I think, who can share our passion in doing what we're trying to do. It's all about patient-centric care and building scale. If they believe, as I do, that we can do this, then we will give them a good return.
What are your targets for next year?
For
the next 5 years?
Yeah,
right?
5 years. Our 5-year target is a 1,000 crore business. Dr. Anand Burman, one of our senior Burman family on the board, he's very excited about the prospects. He talks about healthcare at home being bigger than Dabo one day, and I don't doubt him. So everyone knows it's all about the execution. How do you do it right? I'm not surprised that there are many competitors in home care now. There are several. Obviously, we know Portia and ourselves and Indian Home Healthcare and Nightingales. And that's because people do realise that there's huge potential here. I don't worry about competition at all, because it will all be about who does it best. It's more than enough room for good players. In the UK, we had a 80% market share. We're by far the largest market player. And my view is that that was largely down to being the best clinically in everything we do. That's what we're trying to do here. We want to set out to be the best. We are a premium provider. I know our prices are probably higher than most others, but we can prove that, and the evidence will show that it's still cost effective, and the outcomes and the safety and the patient satisfaction are very high. We measure NPS as a sort of patient satisfaction scores, and those are consistently 65%, so very high.
Moving to the last two questions.
Yeah.
You just expanded in Mumbai, I believe.
Yes,
just about a month back.
Just starting in Mumbai.
Yes. What are your plans for expansion within India, one, and outside India?
Yes.
Southeast Asia, Middle East, are there markets that you're considering?
Yes. I think my view on expanding in India is, it's easy to think of India as just one country, but it's like the size of Europe, really. So it's important not to run before we walk. So as I said, we're in a few cities now and establishing ourselves there, consolidating, making sure we have the right models before moving to, we talk with pharma companies who say, yeah, we like you, can you do 40 cities for us next month? And we say we can't. We've got to do this properly and structured and process and protocol driven. So I'm guessing we will be pan-India, probably a proper pan-India presence and capability over probably the next 2.5 years in the major and tier 2 cities. I think one of the challenges that we haven't really discussed is how, we are obviously focusing on the centres of population at the moment, but 70% of India is in the rural areas. So how do you reach out to these people? Part of our business plan is that once we're profitable, we will have a charitable arm that will reach out to provide services to people who simply cannot access or afford. So that's important to us. The business isn't all about making money. It's making a difference to people's lives in India. I think there are huge opportunities outside of India. As I said, we're trying to address a huge need here, and that's what we're focusing on. I think Middle East and Southeast Asia, there are signs that people are trying home care. And what we want to do, really, I think it's all a matter of timing. The Burmans are interested, for sure. So, and what we have is a technology platform that literally we can pick up and take and start somewhere else. Certainly, my guess would be in a couple of years' time we'll be looking at that seriously. And yes, what I'd love to be able to do is connect home care capabilities in India and Southeast Asia, Middle East, Europe, UK, and actually this is potentially of huge value to pharma industry. Could we show outcomes and compliance rates of their particular drugs across several geographies?
Yeah.
I think that would be of huge value to some of the major pharma players. So there are lots of interesting things going on, and there's nothing wrong with being ambitious.
You took away my last question by answering that rural part, but I'll ask another question based on that.
Do.
So the Indian home care market has kind of seen a spurt in the last 2 years.
Yes.
Where companies have started coming up,
very
and
much so.
you've got good competition out there,
Yeah.
right? And as you said, you are trying to emerge as the best leader in this.
Yeah.
What trends can we see in the next 2 years? Technology has already penetrated sectors. You're talking about tablets and all.
Yeah, yes.
What next?
I think just extending the technology point, I read a report yesterday, another 300 million consumers will be connected by internet in the next 2 or 3 years in India. Your connectivity is very good here, and I think having a patient at home and being connected to a care provider, for instance, who's connected to the hospital, and you join the dots, is very important. So we know, health technology, keeping an eye on your diabetes or your hypertension, and just helping the patient to look after themselves more. I think that's a big trend, because they cannot just rely on the doctor or healthcare professional doing it all for them. So that is a mindset change. But I think India is, you have a lot of intelligent people in India. What's, the rising middle classes, what are their two biggest priorities? Education and healthcare. Now, if you can help them look after their own conditions more, give them more advice on wellness and avoiding disease and avoiding illness, then that could make a huge difference. So I think that's a big trend, and I think home care can play an important part in enabling a more intelligent patient. And not just thinking. I think the other big trend, and you'll see this in the West, is to not think of individuals as patients, but more as consumers of healthcare.
Okay. Thanks a lot. Thanks, Mr. Jones.
Pleasure.